Hey everybody, welcome. We're gonna ask you to go on mute if you're not already muted. And we'll give a quick minute or so for folks to hop online. But feel free to introduce yourselves in the chat. It's good to see all of you guys. Okay. So I'll go ahead and get us going. I will quickly introduce myself. My name is Jasmine Akufu. I'm one of the senior program analysts on NACCHO's Health Equity and Social Justice team, and we are very excited to do a soft launch of our revised and updated Roots of Health and Equity online course series. So if we can bump to the next slide. Thank you. So I just want to briefly take a moment to introduce my team. So a lot of different folks have had their hands in kind of updating this course over the past couple of years. I introduced myself already. I want to acknowledge Brianna Aldridge, who's another one of our senior program analysts at NACCHO, who was instrumental in a lot of this project. And then more recently, Charles Udezi, who is one of our program analysts, and Maya Smith, who's one of our senior program assistants as well, who've been instrumental in this project more recently. So for folks who are not familiar, we can go to the next slide. I think everyone should be, I'm assuming most people are familiar with NACCHO already, but for folks who are not familiar with NACCHO, NACCHO is the National Association for County and City Health Officials. We serve around 3,300 local health departments across the country and do a lot of work focused on supporting health departments, advocating for local public health, developing different resources, and trying to optimize strategic alliances and partnerships. And then we can hit the next slide again. So for folks who are not familiar, Roots of Health and Equity is one of NACCHO's flagship resources. The image that you guys see on the top right hand of the screen is the course as it stood since 2011 up until May 30th of this year. We have spent the past couple of years revising and updating this course significantly. And so the image you see on the bottom right is what the course looks like now, as of the soft launch on May 30th of this year. For folks who are not familiar with Roots, it is a free educational website and collaborative learning resource for current and future public health professionals. As part of the course series, it's really focused on helping folks to recognize and understand what the root causes of health inequities are, explore different social processes that produce health inequities, and then really getting folks to learn how to strategize more effectively to act on the root causes of health inequity. So in terms of why we made some of the revisions over the past couple of years, we can go to the next slide. We really wanted to take the time to reflect some of the new developments in the field. So, health equity has been a term that's been in use for a while, but especially in the past years, folks have been using it a lot more frequently. There's been a lot more scholarship, a lot more leadership out in terms of trying to really focus on health equity in our field. There's also been different evolutions in the way some folks talk about root causes. So in particular, when we think about how we talk about gender and sexuality in recent years compared to like 10 years ago, we wanted to make sure that the course was really reflecting some of the changes in the dialogue around different social justice issues and health equity issues. And then just generally wanted to continue supporting the public health workforce as we are coming into this space where we're trying to really more directly address health inequities. So I'm going to pass it on to my colleague, Maya Smith, who's going to talk through some of the updates and features that the new course has. From there, we'll share some of the things that we have coming up in terms of the official launch, and some of our post-launch activities as well. And we'll also have a demonstration of the site for you guys and a brief activity to model or demonstrate some of the dialogues from the course. So I'll pass it on to Maya.
Thank you, Jasmine. I want to quickly go into kind of why root causes, why are we focusing on the root causes throughout this course? The root systemic factors are what influence social determinants of health, which is what public health has been focusing on more recently. And ultimately, they create adverse health outcomes. So in the new course, we're using the imagery of a tree, in which the roots are the isms that create health inequities, which sprout into the trunk, the social determinants of health becoming the branches or the health outcomes, and then the leaves, which is the individual health behaviors. So these root causes that we're focusing on are capitalism, racism, sort of colonialism, sexism, and more. And these can be very overwhelming to target, which is why we've created this course to help you get started. Next slide, thank you. So Roots provides this conceptual framework to link social justice to our current public health practice by focusing on these root causes. It provides many resources and insights for learners and users to look into, but also share with others, create networks, and collaborate. We have a lot of opportunities for reflection and actions for confronting these root causes of health inequities directly, and many opportunities to collaborate and strategize with other colleagues and partners through reflection, discussion posts, and other interactives as well. So our course series has 10 courses, which has obviously been expanded from the original version. We start off with a why root causes, which goes more into depth of kind of what I just talked about, why this root cause work is important and where we can start. We then move into social justice, which is how to intertwine social justice with our public health work, kind of a background on social justice movements and their relation to public health as well. Course 3 is public health history. We at NACCHO define health equity using Dr. Kamara Jones's definition, which includes rectifying historical injustices in order to move forward equitably. So really diving back into public health history to know where we can move forward from here and rectify those injustices. We then have our 3 really root cause courses. So course 4, which is white supremacy and structural racism, course 5, which is capitalism and class, and course 6, which is cis heteronormativity. We then move into a few courses about power. Course 7 is building narrative power. So discussing 3 big narratives and how they show up in public health, but in our society more at large, and how they create health inequities. Power and health equity, how we see power come into play in creating these structures and perpetuating health inequity. And then we move into building community power, the importance of working with communities to create more equitable communities that we work with. And then course 10, which is reimagining the public health workforce, really giving a starting place to do this work and how we can target these root causes and center that within our public health workforce. So each course follows the same progression. They will contain 3 chapters. Each course will actually begin with an introduction and overview video. And then chapter 1, which will really introduce the topic and define the key terminology necessary and provide any historical context necessary for us to then dive into that chapter, kind of asking how did we get there? We would then move on to chapter 2, which is the contemporary manifestations of this root cause or of this public health history relevant to each course, and how we can apply public health practice to target these health inequities. And then chapter 3, where we provide strategies to take action, and then there's also a lot of opportunities for facilitated dialogue and discussion, followed by a course wrap-up page to finish each course. Each course will also have many videos, interactives, discussion prompts, voices, activities, case studies, and other features throughout the course to make the course interactive and collaborative as we go through. So moving into the course design, we have made some significant changes to the course design. The course series is customizable. We want everyone to be able to choose their own adventure. So you may take it individually or with a group. We would love for you to take all the courses, but we know that's a big thing to take on. So just choosing what courses really resonate with you individually or your organization as a whole. We also have many interactives as one of our new features throughout the course. We have one called What the Census Calls Us, which takes place in course 4, the White Supremacy and Structural Racism course. And this interactive shows how the US Census racial categories have, quote unquote, evolved since 1790. We also have an interactive that talks about wealth inequality in course 5, the Capitalism and Class course. We have a power mapping interactive in course 8, which you can see below. That is our Power and Health Equity course. And then, as I mentioned, there are discussion prompts throughout the courses to really engage with each other and have productive dialogue. And the course is free to sign up, and we encourage you to engage at your own pace as well. Another feature of the new course is we have over 30 expert voices with different representations from the field. So the public health field specifically, we're looking at academia and then also community members or community-based organization representatives. And we've also created many course overview videos along with other videos to supplement the course material. These include site introduction, power explainers, clips that can aid in content and make it more digestible, but really just to give more context or make the material a little more digestible as you go along. And then a few more additional updates. We have a course glossary. So as you scroll through the course, you'll see some underlined key terms. If you hover over these key terms, you'll see a short definition of this word. And then you also have the option to explore it further in our glossary. And that definition will provide more context, a longer definition for you to really understand the term. There is also a site narration feature. Each course has the ability for it to be narrated. There's just a little button at the top that says use audio, I think. So if you press that, it will read through the material for you. We also have a Spanish translation that is located at the top of the Roots page if you want to switch to Spanish instead of English. And we've also greatly improved our site navigation and accessibility of our course as well. I'm going to hand it back to Jasmine to do a brief course demonstration.
Thanks, Maya. So I'm happy to walk through for folks a little bit about how to navigate the site. Can everybody see right now my screen in the course? Okay, awesome. So this is the site as it is right now. I will drop a link. I'll wait to drop the link at the chat at the end so folks can explore, but it's rootsofhealthinequity.org. So when you come to the site, this is the main page, the landing page, where folks are able to kind of see this beautiful image and then can kind of scroll through what the different courses are. If you are not logged into the site, what you'll have access to is a preview of each of the courses. So I will go into this course 2 preview. And so folks will get a sneak peek. Each of our courses will have an overview video where they'll get like a quick look or a quick overview of the content that they might expect to see in this course. I'm not going to play this whole video, but you'll kind of see.
Hello, and welcome to Course 2. In this course, we're going to dig deeper into social justice as it relates to public health.
So folks will get they range from anywhere from 4 minutes to maybe 7 minutes, where folks will get a brief run through of what they can expect to cover in the course. You'll also have a brief descriptive in terms of what the purpose and overview of each course is. You'll see some highlights or some of the key interactives and key activities that are in the course. And then you'll also have the option to determine if you want to take the course independently and just kind of go through at your own pace, or if you want to set up a group for folks within your department and take the course together. So with that being said, I'm going to go into one of them, and I'll go with our positionality exercise. So I think it's pretty cool. So there's a number of different interactives throughout the course that kind of illustrate different concepts. For folks who are not familiar, intersectionality is a sort of framework that talks about how different systems of oppression intersect and interlock. Positionality talks about how we're positioned differently within different systems. So we all have a range of different identities, right? Like we don't just have a racialized experience, we don't just have a gendered experience, all of those things at the same time. And with the positionality exercise, it's helping folks have an understanding of how our positionality creates differences in access to power for each of us. So whether you're thinking about something like your gender, and thinking about how folks are defined and positioned with power in that regard, or thinking about some of the ways we're positioned with what our social determinants of health look like. So, what our housing access looks like and what that means for the types of resources we may have access to, and what that means for our health conditions as well. So that's one interactive that I'll show you guys. Another one we have, which Maya mentioned, we have what the census calls this one. So this one kind of provides an evolution in terms of how race has evolved over time. So the entirety of this course on white supremacy and racism is basically talking about how race we know is a made-up construct, right? But at the same time, it's informed vastly the way that we practice medicine, the way that we practice health, the way that it's kind of structured our society. So giving folks an opportunity to see kind of the fluidity of it, the way that these different categories have changed over time, the way that people have been counted or not counted at different points in time. And then you see kind of an explainer for why different groups were kind of added at different points in time as well. And then opportunities to reflect throughout the course through different discussion prompts. So one thing I will mention, whether you're taking the course independently or as a group, you'll be able to see folks' responses in your group. So if you set up a group for just your department and you guys are having a discussion within the discussion prompts, you'll be able to kind of communicate and dialogue with each other online through this platform. If you're joining as an independent learner, you'll see the comments from everyone who's in the kind of general group. And so that being an opportunity for dialogue as well. And then another interactive that I'll demonstrate briefly is from our Capitalism in Class one. And this one is getting folks to think about how wealth inequality and income inequality gets created and how that leads to inequality, inequities, and access to resources and what that means in terms of our health. So this interactive in particular is showing the vast level of wealth inequality throughout society and how that's evolved and increased even over time as well. The next thing I want to demonstrate for you guys, I'm going to go into our Power and Health Equity course. I forgot to mention each purpose and overview page will also have a learning objectives listed for the course. I want to show you guys specifically our glossary functionality, so I'll navigate to that page. But One of the things that we talked about a lot with our expert advisory group, who were really instrumental in the redesign of this course, was the importance of the language that we use, how we use it, why we use it, and so on and so forth. So one of the major updates to the course was adding in this glossary. So throughout the course, folks will have an opportunity to see key terms and get a better understanding of what those different terms mean. So you'll see with the underlined text, folks will be able to click and get like a short definition, but they'll then also be able to click into our glossary and get a fuller definition as well as sources and whatnot, if they want more of an understanding of what that term means and where else it appears within the course. And then within the fuller glossary, you're able to kind of sort through and filter by course the different terms and concepts that come up within the course. The other thing that I will show folks just briefly is our FAQs page. So for folks who are interested in taking the course but have questions, we do have some prescripted responses based on some of the common questions that we've gotten in the past or that we anticipate getting as a place for folks to start. But with that being said, we're actually going to go into our questions portion with y'all right now. So I'm going to stop sharing and see if folks have any questions based on what I covered. One quick thing I forgot to mention as well, we've also gotten the entire course translated as well. So when you go to, from whatever page you are on in the course, you'll be able to click over and access the course in Spanish. And we're exploring options to see if we can translate it into other languages in future, but for now, just Spanish is what we have. So I'll stop sharing again, and we're happy to answer any initial questions that folks have before we kind of keep going through our agenda.
Do we have to raise our hands to ask questions or put them in the chat?
Either option is fine if folks want to raise their hands or put them in the chat. So the official launch will be in July at our NACHO 360 annual conference. We'll be having an official launch event as well as our Health Equity Town Hall. And we'll have details on the date and time and location of those at the end of the presentation as well. So at this time, we'll have a certificate of completion that folks will be able to access when they complete the course. We were looking into continuing education credits and had hoped to be able to have that accessible at the time of launch, but we're currently having to look into other options. So more to come on that in the future. And there will be a revised and updated facilitators guide for this new version available in mid-August. And if there are no other immediate questions, I'm going to pass it to Charles, who's going to keep us going. But if folks have other questions that come up as we go along, feel free to put them in the chat, and myself or Maya are happy to answer them that way as well. Thank you.
Thank you, Jasmine. Before we move on, I did want to just share a little word about critical pedagogy and the role that that plays and how we were able to craft the course. And you'll find them throughout the activities as you engage with Roots of Health Inequity. For those that don't know, derived from the works of Paulo Freire, Bell Hooks, Antonio Darder, and many others. The central goal of critical pedagogy is to promote emancipatory actions through teaching and learning. Within the context of our work, that is to say that public health has always been intrinsically linked with principles of social justice and democracy. While our job titles and roles may serve specific functions at our organizations, we all have a role to play in the dismantling of systemic barriers and oppressive structures. Roots highlights the role that collective action throughout the courses and aims to realign and reaffirm public health's roots with social justice by encouraging users to reflect on the social and political context that their work and their residences reside in, and imagine a more just future together. To aid in the process, Roots offers many interactive pathways for users to embark on its courses with their friends and colleagues. To provide some examples, moving on to the next slide. From the old Roots course, you'll find that numerous local health departments, academic institutions, and even federal agencies have used Roots to get their staff all acquainted with principles of how we would tackle root causes together. For example, Cook County and Illinois used the Roots of Health Inequity course to increase their staff's capacity to fulfill their mission to achieve health equity. These modules were used on a basis of 5 months, in which 50 staff participated during work hours in sessions facilitated by leadership to undergo the Roots course and talk about some of the concepts described in each of the courses. Seminole County did something similar where they required all the staff of their Office of the Minority Health and Office of Men's Health to take the Roots course. And according to their public health officer, the course really opened their eyes, having everyone have a similar baseline on the principles of root causes and how to address them, help them address their work with that framework in mind. Same thing with Madison and Dane County, where they had their summer interns take certain portions of the Roots course. They met bi-weekly to have in-person discussions about the content, and through that, they were able to learn collaboratively. As mentioned before, academic institutions have also been using this. We have a number of different colleges and universities that implement some of the Roots course content in their own courses. So for example, University of Maryland, where they use some of the concepts around community engagement described in Roots to form their environmental health undergraduate course. And federal agencies work really closely with the Health Resources and Services Administration to have staff there take the Roots of Health Inequity course. So far, they've convened 25 different staff cohorts, totaling about 500 or 400 staff. They've all taken the Roots course. They've had volunteer staff facilitate the course, and they've reported great results. And so these are all examples of how this collaborative learning structure has facilitated learning about root causes together. We actually have another testimonial for all of you from Iowa. So Arthur at Mahaska County Hospital in Oskaloosa, Iowa, shares that in his rural local health department, they utilize NACCHO's Roots course to better understand the systemic and upstream factors that lead to health inequities. Through weekly team meetings, they dedicated about 10 to 20 minutes to group learning, which included discussing and reflecting on course content, applying course content to current initiatives, listening to feedback, occasionally reading important passages together, and assigning specific downtime objectives, not homework. The structured course was informative, interesting, and helped the team build perspectives to engage in. As a result of this and 2103's, their participation as a 2103 grant recipient, the team's communications has become more open and transparent. This has transformed their department's public health communications and social media posts, as well as guided community interventions to focus on what we can do at the systems level, and encouraged active advocacy for policy change. They're looking forward to the new Roots course. We love getting testimonials like that. We hope through this next rollout of the Roots course series, we'll get to understand how other folks are using the Roots course and provide whatever tools and resources necessary to facilitate the learning experience. To do so, we have implemented a few new features, updated a few new features, and bolstered, kind of beefed them up so that folks will be able to engage more directly with one another. First off, we have our Roots of Health Inequity virtual community, which will serve as an online discussion board and resource repository for Roots users. It's a space to share information about how the work is going, share resources with one another about course, maybe talk about certain concepts discussed in the course and emerging health equity topics. We encourage Roots users to ask questions and share their resources with one another in this space, build trust with one another, and possibly partner with one another to address health inequities, since that's such a key piece that's discussed throughout the course. In August, if you'd like to join the virtual community, you can log into your MyNHO account and find the Roots virtual community under special interest groups in the virtual community section. More information will be shared with everyone soon. And going back to that slide, there are also other features for improving group functionality. So if you go onto the Roots course, you can create a group if you'd like to take the Roots course within your organization, whether you're convening a cohort, similar to some of the examples mentioned earlier. You can feel free to create a group, assign the users that you'd like to be in that group to join your group, and go through the course content together. Group leaders will be able to track the progress of their cohort, and hold those maybe in-person or online discussions with one another, learn with one another, see how folks are interacting with the content through their comments and engagements with polls and other activities on the Roots course. And so we want to ensure that we are encouraging folks to take the Roots course, any of the Roots courses, as a group, being that there's so many, and we want to ensure that everyone is, again, engaging with each other critically on how they're applying course content. We find that having that functionality available facilitates that experience. If you don't choose to go through this in a group, you can take this individually, of course. You will still be able to comment and see the comments of other Roots users taking the courses individually. You'll be able to reply to them, maybe share further points, hopefully connect and learn together. So you'll also be able to see results from some of the polls, and see how other folks are interacting with content. And then, of course, finally, we have the updated facilitators guide that we are working with Health Justice to develop. This facilitators guide allows organizations to delve into the courses together through activity, discussion, and reflective-based facilitation, helping to understand the content. The updated facilitators guide will be publicly available on the site alongside the course content. In it, we'll hope that you'll find various frameworks and guides to aid facilitators in moderating and encouraging dialogue and reflection with their groups. We want to show you an example of our facilitators guide activities through a demonstration. This portion will not be recorded. Thinking about our post-launch activities, there will be opportunities for users to be able to ask us questions and talk about how they're using the course at their own organizations. This starts with office hours, which will be hosted every second Tuesday of the month till the end of the year from 3 to 4 p.m. on Eastern Coast time. Again, these are opportunities for folks to come in, ask questions about maybe course content or how they can use the course at their organizations. We hope to learn from all of you how you're using the course at your organization and provide any assistance that we can to facilitate the learning experience. If you'd like to join us for office hours, feel free to register at the QR code on the screen, or visit us at linktree/NHO-Roots, where you'll find the sign-up link for office hours. And you can sign up month by month and join us for the office hours calls. As previously mentioned, we will also have a virtual community for everyone to join, share resources, ask questions, talk about emerging health equity topics. This will be an online resource repository for users of Roots. If you'd like to access the Roots virtual community, you can sign up in August by going to the My NACHO and finding the virtual community under the special interest group section. You can navigate to the link there to get to that portal, or go to your My NACHO link and you should be able to find it under the virtual community section. Of course, if you have any questions, we have our Roots of Health Inequity at nacho.org email. You can always ask us any questions about the course, and we're happy to assist you in any way that we can. So feel free to email us if you have any questions. Moving on. We also have our communications toolkit. Again, accessible through the link tree at /NHO-Roots link. You'll be able to find different flyers, plum cards, slide decks, logos, whatever to promote your promote Roots on through your own channels. There'll be a newsletter. There are newsletter blurbs. There's press releases, and also talking points. These talking points are meant to be templates for you in case you want to promote Roots to your organization or constituents or community partners. It provides basic info on what Roots of Health Inequity is and addresses some frequently asked questions, as well as some other points of discussion that might come up in your conversation around what is Roots of Health Inequity and how can this make my organization better equipped to address health inequities. That toolkit is accessible through the QR link, or again, you can go to the link tree and find it there. Otherwise, we want to thank you all for sharing the space with us. Feel free to email any of us or the Roots of Health Inequity at nacho.org email. We're happy to have conversations with you and facilitate your experience using Roots of Health Inequity. We're really excited to launch the course alongside you and really excited to see the work that comes out of it. Thank you all for sharing the space with us, and have a wonderful day.